Hi, my name is Samira Hussein, and I'm honored to be here as part of the 2025 Women Lived Health North America cohort. I'm a senior advisor in Canada's Health Ministry on infectious disease and vaccination program policy. I am also an adjunct professor at the University of Ottawa and sit on the advisory board of the Canadian Institutes for Health Research and editorial board for Globalization and Health. Throughout my career trajectory, I've been fortunate to be surrounded by leaders in academia, government, and civil society who are committed to health equity and a representative leadership in the global health workforce. I take this forward by supporting the career progression of racialized women health professionals. I'm truly proud to be working in a health ministry where women are at the forefront of leadership, as you can see in this picture from the 71st World Health Assembly. That's in part due to Canada's deliberate efforts for gender parity in the federal public service. Our health portfolio took this further, recognizing the importance of intersectionality and articulating that equity, diversity, and inclusion in policies and programs lead to better health services and outcomes. To me, this also means that at every level, the health workforce should be representative of the populations we serve and have access to career advancement opportunities. Research shows that equity, diversity, and inclusion in the scientific and health workforce promotes innovation and equitable access to quality services for our populations. And so my leadership project is focused on Canada's approach to staff mobilization under requests for assistance, or RFAs, as part of the WHO's Global Outbreak and Response Network, better known as GORN. My organization, the Public Health Agency of Canada, is the ministry's decision-making body on all health-related international RFAs, in line with the agency's mandate for responding to public health events and emergencies. Since GORN's establishment in 2000, 189 Canadian staff have been deployed to share the expertise requesting countries need to respond to health events, while our health workforce's capacity and knowledge are increasing our emergency preparedness. I initially wanted to examine for this project the interplay of our global health approach, health security, foreign policy, human rights, with government practices and how these influence international mobilization for Canada. But between its development and implementation, my project shifted. Due to climate change effects, migration, mis and disinformation, increasing inequality and infectious disease threats, the global health landscape is now more complex and requires intentionality in cooperation for health emergencies. Changes in leadership and governance in many countries triggered policy changes, such as a divestment in funding from health systems. Changes in political leadership in Canada brought a shift in government priorities, which for the agency has meant an emphasis on sustainability as we wind down from the pandemic to apply lessons learned in a context of fewer financial and human resources. One example is the revision of our health emergency response practices around the recruitment, selection, retention, and mobilization of employees deployed through RFAs. For me, organizational change has meant navigating employment uncertainty. Resource reductions have resulted in a discontinuance of functions, including mine. And there was an impact on me, both as a manager supporting affected employees and as a job seeker in a rapidly diminishing global health space. Uncertainty was felt all across my organization, and the people I needed to interview were occupied with change management in addition to their day-to-day mandates. The Women Lived Health program and community became even more important for me, particularly around learning touch points on leading change, developing others, and leveraging one's own networks and power. So my project now had new variables and my timeline had shifted. And as I finalized my analysis from the desk review and interviews, I've noticed some gaps. For example, the application of the health portfolio sex and gender-based analysis plus policy in the employee selection, training, and mobilization pieces of RFAs. Also emerging from the interviews were calls for a strategic approach for mobilization, given the imperative to work within limited resources while navigating an increasingly unpredictable governance space for global health. So I'm developing a framework that's epidemiologically informed, strategic for the organization, and represents coherence across different policy considerations, including gender and intersectionality commitments as part of a considerations package for the agency's senior leadership. Outside of my project, my overall journey this past year has been one of growth around 4 key areas of leadership: I have sharpened skills and new tools, and with those, I look forward to stepping into my new role next month, where I will lead with strategic vision, agility, integrity, and develop others while fostering strong, diverse, and healthy teams. I wish to express my gratitude to the women I've had the privilege to meet through this program, as well as my family, friends, mentors, and colleagues whose support enabled me to undertake this unique and beneficial journey. Thank you so much.